involved in some of the pathways that Peter talked about with interferon activation, anti-DNA antibodies, which are really very characteristic of lupus, can also bind to a particular receptor on cells in the brain. And if too much antibody is around, the antibody can actually kill brain cells. If less antibody is around, it actually alters brain function, but that's reversible. And so we've been very interested in how these antibodies work. With another investigator at the Feinstein, who's a medicinal chemist, he has identified a small molecule that will block these antibodies. And so we've been able to show that his molecule will be able to block these antibodies from binding to cells in the brain. They'll block the antibodies from binding in the kidney. And we're very hopeful that this molecule will actually become a therapeutic in lupus. I should say, or maybe I should turn it over to Peter to say that this chemist is involved in looking at another pathway that's involved in lupus.
Right. There are some genes that we know, as I mentioned before, that are involved in lupus that seem to regulate how well the immune system responds to various kinds of stimuli and triggers. And this same medicinal chemist, Yusuf Alabed, has been helping us to develop drugs that modify that pathway as well. So each one of these ideas about what's going on with the disease inevitably leads to ideas about how one could use drugs to modify those pathways and improve disease outcome.
And I think that our goal in all of these studies is to learn enough about the pathways so that we don't eliminate their activation, but we modulate them. So we end up with a lupus patient who no longer has tissue inflammation from autoimmunity, but is not immunosuppressed. Because currently the medications that we use for treating lupus cause people to be more susceptible to infection. And we'd like people who don't have inflammation from their autoimmune disease, but are able to mount an effective response to infection.
And that's really what the genes are telling us, is that the variation in the genes that are associated with disease lead to modest changes in the level of response of cells and the immune system in general. It's not as if everything's knocked out of whack completely. They're just changed a little bit in their threshold.
And maybe this takes us back to the sister study.
Yes.
In a way, because, it generally takes people 15, 20, 25, 30 years to develop lupus. And you can often see some of those changes in the immune system's function years and years and years before you can diagnose disease and before the individual has any symptoms of feeling unwell in any way. And that's because it's little changes that over time accumulate until the system's out of whack. But it takes time, and it probably takes some outside event to really cause that out of whack moment to happen.
Yeah, so being able to look at those subtle changes in sisters who are otherwise well, and you don't have the complications of them having real inflammation going on in their kidney or their brain, or being on drugs that drastically alter the function of the immune system, it's very difficult to find out what's going on in the setting of such major changes. But the sisters will offer an opportunity to look at the system in a more subtle way.
Is there an exact test to determine if someone has lupus? Or if there's not, do you think that there will be?
Oh, that's an interesting question.
Yeah.
So at the moment, there's not an exact test. There are tests that look for autoantibodies, anti-nuclear antibodies, or anti-DNA antibodies, or an antibody to a protein that's involved with RNA called Smith protein, anti-SM antibodies. And each of those can contribute to the diagnosis of lupus. You can also look for low levels of a blood substance called complement, which means that immune complexes, antibody-antigen complexes, have formed in the body and use up complement, and the rest is symptomatic. So the rest is looking for evidence of dysfunction of lungs, kidney, joints,
Skin rash.
anything. And then you can biopsy the tissue and you can look for changes in the biopsy that are characteristic of lupus, but we don't have one test that says lupus yes, lupus no.
Do you see in the future there actually being a cure for lupus?
Yes.
Okay.
Yes, I think
Yes.
that we'll learn how to intervene in certain pathways, and we'll learn how to do it more delicately than we do it now, where we don't just kill large numbers of cells in the immune system to decrease the amount of activation, but we actually change the threshold for activating cells in the immune system, and we will end up with people who have a competent immune system and no autoimmune disease, no lupus. And again, that's part of the Sisters Project. Part of the Sisters Project is being able to identify people early so we can intervene early and we can show that we've made these significant changes in the immune system.
Okay. Do you have anything to say to any discouraged lupus patients? Or any advice?
Well, I think, it's always difficult when you have a chronic disease, which means a disease that may leave you sometimes feeling better, sometimes feeling worse, but doesn't have a cure at the moment, not to feel as if it's exhausting to deal with, or it's not fair, or whatever. And those are reasonable thoughts. But I think one of the other things that we've learned about lupus is that people who feel that they have some control over their bodies do best. So the best advice for a lupus patient is to learn about the disease, to understand the disease, understand the medications you're on, start learning what are the earliest signs of a flare in your own body, because you're a better barometer of that than any tests we have, and feeling as if you can exert some control over what's going on, because those are the people who do best. It's a sense of empowerment that patients need to have and physicians need to help patients have.
What can lupus patients do to help further your research?
Well, I think the most direct thing they can do at the moment is, if you're a lupus patient with a sister who is currently well, to encourage that sister to enroll in the sister study. This is a very large national study. We're hoping to get many thousands of sisters to participate, and that's really necessary for us to really understand the whole complex array of immune abnormalities that might be going on in those sisters. So it's a very kind of easy thing to do that would be incredibly useful.
Stay aware of what research is going on in lupus and then make a decision for yourself whether that is a research study that you'd be comfortable being involved in. But progress in human disease is a collaboration between patients and physicians and scientists. And so, scientists can't make progress without patients, and patients can't make progress without scientists. So everyone has to look at what they might be involved in and find out which of those projects they would be comfortable being involved in, and then get involved. I think most people who do find it very gratifying.
Yeah, I would also add that, from the point of view of scientists working on this general problem of autoimmunity and lupus, the current environment is incredibly exciting and full of promise and lots of new technologies. It's very similar in a way to the kind of progress that's gone on in the computer world, where it's just totally exploded. And there are so many opportunities out there to make new discoveries and understand. And one of the major barriers now to actually translating that into practice is to develop a collaboration with the patients and their families to allow those technologies to be applied to large numbers of people so we can make the discoveries.
I think the important thing to realize is that any time you get involved in clinical research or clinical trials, you still maintain total control over what you want to do, when you want to leave the trial, when you want to leave the study. You should be informed about any results that are coming out, and this isn't something where you feel or ought to feel as if you go, you make a contribution, and then you don't know anything else, or you have no control over anything. This should be a real partnership, and we believe that we really partner with our patients and really value that partnership in the studies we do here. But any study anywhere that somebody wants to get involved in ought to be a partnership.
I think the other thing to say also is that maybe people feel, well, there are lots of patients with lupus and I'm just one and so I'm not so important. But in fact, although lupus has a unifying theme of dysregulation of the immune system, it's probable that there are many different ways to get to that dysregulation, either different environmental exposures or certainly lots of different combinations of genes. So in fact, any person brings information about their disease to a study that is unique and that could in fact be quite valuable in and of themselves, as well as being part of a population of people participating.
And that brings us back to the sister study that we're so committed to, because one of the things that we hope to learn in that study is the earliest immune dysregulation and how many different pathways. So we know about the interferon pathway. What are the other pathways that occur early in patients that might be able to distinguish between one group of patients and another group of patients? And the reason that's so important is that the best therapy for one group may be different from the best therapy for the other group. It's probably highest in African Americans, it's high in Asians, it's high in Hispanics. It's interesting. It brings us back to lupus being a disease of genes and environment, because to the best of our knowledge, the incidence in African Americans is higher than the incidence in Africans. And it's probably because of the different infections that you're exposed to when you're in North America or Europe as opposed to when you're in Africa. And so it's probably highest in African Americans.